What's up YouTube, I'm Mike, and today I'm going to be talking about how a particular ancillary drug that you might be using in your steroid cycle could potentially save your life should you come down with COVID-19. That's right. So I was actually doing research for the next video in the Bob Does Steroids video series, talking about all of the compounds he's going to be using in his upcoming bulk, and ran across some interesting connections to the SARS-CoV-2 virus, which causes the COVID-19 disease. Now, I do not talk about COVID on my channel at all, because no matter what you say, you typically offend somebody on one side of the fence. But hopefully we can all agree that not dying of this disease is a decidedly good thing. So for those of you who don't know, quick science lesson, basically the way viruses spread is they have a spike protein that allows them to connect to other cells in the body and then invade them so that they can proliferate inside of your system. It just so happens that SARS-CoV-2 uses angiotensin converting enzyme as its sort of host cell. And so when I came across that, it made me think, I wonder if a drug like telmisartan could have any effects on the COVID-19 virus. Telmisartan is a very commonly used drug amongst bodybuilders and worldwide for controlling hypertension, for controlling your blood pressure. And so that is in fact a drug that I use myself, and that our buddy Bob, of course, is going to be using in his next steroid cycle. And so I decided to look it up and see what I could find. It turns out that there is in fact good data suggesting that angiotensin receptor blockers like telmisartan could significantly improve outcomes in patients that have the COVID-19 virus. So I'm going to be sharing with you a study that I found during this research and put it up on the screen for you to follow along. We're not going to go through line by line of everything because I don't think most of you care. I'll also link it in the description if you would like to look at the data on your own. Again, the study was done in Buenos Aires. It was using 18 and older individuals who were already hospitalized with COVID-19. They were using it in an ICU setting, so clearly things are not going well for these individuals, unfortunately. And they used a dose of 80 milligrams twice a day for a period of 14 days. In the bodybuilding or just sort of normal, otherwise healthy adult environment, we're looking at a dose of 20 to 80 milligrams typically for controlling your blood pressure. So at 80 milligrams twice a day, this is a substantial dose, and they decided to look at two things. What were the C-reactive protein plasma levels at days 5 and 8 after randomizing? So of course you've got controls and then you've got a telmisartan group. And then the secondary outcome, which we're going to be touching on in this video, is the median time to discharge within 15 days, as well as the death toll at days 15 and 30. So what they found in this study, now this is a study of 162 patients randomized in two groups. You've got controls in the telmisartan group. The telmisartan group, again, is getting 80 milligrams twice a day. And an analysis of the study confirmed that telmisartan treated patients had a lower median time to discharge. Controls were discharged at 15 days, telmisartan patients at 9 days. So substantially quicker time to leave the hospital, which is obviously good for everyone involved. The death toll by day 30 was reduced from 22.5%, or 16 out of 71 patients in the control group, to 4.29%, or only 3 of 70 patients in the telmisartan group. During this trial, no adverse effects were reported. At the end, the interpretation of the study is as follows. Our study suggests that the ARB telmisartan, a widely used antihypertensive drug, is safe and could reduce morbidity and mortality in hospital patients infected with SARS-CoV-2 by anti-inflammatory effects. Further studies employing telmisartan are needed for confirmation of our result and to define its true therapeutic value as a tool against COVID-19. So that is in fact already happening. If you dig a little bit deeper, you will find that there are already clinical trials undergoing right now where they're using a much lower dose, 40 milligrams once a day, and they're administering it to patients who basically have just come down with the virus in hopes of making sure that they don't end up in the hospital. Apparently my daughter's not happy with my video. Trying to make sure that these patients don't end up in the hospital and have ever worsening conditions. So that dose is particularly relevant to people in the bodybuilding community or anyone who just happens to have to manage their blood pressure. 40 milligrams is a very reasonable dose. It is in fact the dose that I'm currently using, and coincidentally the dose that Bob will be using on his upcoming fall bulk. So there you have it. I would make it very clear, I am not a doctor. This is not medical advice. I'm certainly not suggesting that everybody run out and buy telmisartan, which was one of the reasons I wasn't going to produce this video, because like I said, people are so panicky at this time. They're desperate for anything that might improve their chances of survival in a scary period. So I certainly don't think that everyone needs to run out and jump on this drug, and I'm definitely not advocating that. But I did just want to bring it forward because I think it's interesting. Obviously, anything that we can use to combat this virus is of value. Is certainly a drug that is readily available, that is very cheap, and is very well tolerated by the vast majority of people who use it. So there you have it. I would love to get your opinions about this particular compound or this particular drug. Do you use it in your cycles? Obviously, this is not the only drug that they're looking at trials for. They're looking at was it valsartan? They're also looking at angiotensin converting enzyme drugs. There's a number of drugs in this sort of little arena that they're looking at, but I think it's the ARBs that are currently showing the most promise. So you could potentially make the egregious leap that if you happen to be on a steroid cycle right now using telmisartan, that you might fare better should you happen to come down with COVID-19. Now, obviously this is a terrible time in history to be using steroids. There's any number of effects they have on the body that are likely not going to improve your odds of survival should you come down with this virus. So again, I'm not advocating anybody to do any of these things. Just thought I would bring this data to the forefront because I thought it was interesting. As always, follow me on Instagram for more of my daily lunacy. I haven't been posting as much. If you want to know my opinions on this, you certainly find them on Instagram. Comments in the section below. What are your experiences with different ARBs for use in controlling your blood pressure? What kind of doses are you looking at? What kind of results have you had? And as always, we'll see you on the next one.